Coming to ankle. Now, ankle joint. What are structure are there? In ankle joint, what are the composition of ankle joint?
Dorsal bone.
Dorsal
Posterior surface
lateral malleolus, medial cuboid, and talus.
Okay, nice.
Calcaneus.
Don't be perfect anterior surface, superior surface. Tell me the bones. Tell me the joints first. Be simple. Don't jump to a hyper level.
Fibula attached to
Lateral end, lateral malleoli is the part of tibia. Is the part of fibula. Sorry. Then medial malleoli, part of tibia. Then talus. Okay. These three are the structure which make up ankle joint. These three are the structures. Now this, if I take this as a structure, once this structure, if I take it as medial malleoli, this structure, if I take it as lateral malleoli, then the person who sits here is talus. Okay, and this, what is there is dorsiflexion and plantarflexion, which occurs in ankle joint. Understand? So this is called as ankle mortise. The name of it is called as ankle mortise. Okay, mortise is nothing but a cup with a T. This is a cup, right? Cup formed by what? Medial malleoli and lateral malleoli, and then a person sitting a bone. Now this is what happens. This is what is ankle joint. Because of this structure, there is dorsiflexion and plantarflexion. After any injury to the ankle, patient has a problem in dorsiflexion and plantarflexion. Okay. There is one more joint here. What is that joint?
subtalar.
Perfect. Subtalar joint. What is the composition of subtalar joint? That is the movement. What is the composition?
Talus and
Talus and calcaneum. Perfect. Now talus is there and calcaneum is there. Any movement below the ankle joint, there is again a joint. After the talus, talocalcaneal joint. Talocalcaneal joint is also called as subtalar joint. Guys, both are different. Both are different. If anyone says inversion movement, it is subtalar joint. If person says dorsiflexion, plantarflexion, it's ankle joint. Both are not same. Please don't get confused. I'm telling you repeatedly. Stiff. If person says that, doctor, there's a problem in inversion, eversion, you have to think that it's the problem in subtalar joint. Doctor, I cannot do dorsiflexion, plantarflexion. It's ankle joint. There you do anything with calcaneum, nothing will happen. Because the problem is in, stiffness is in ankle joint. Understand this, guys? Make it point clear. Now, how to mobilize this? Now, as soon as, see, if I keep a hand on my lateral malleoli, okay, and keep a finger cup like this on my medial malleoli, exactly at the web space is my talus. Exactly at the web is my talus. Okay. Now, what happens is, talus cannot be palpated so easily because that bone is inside and many muscle tendons are up. So you cannot palpate it easily. So what you have to do is, basically, what the people do is, I will come that side. It's easy for me. Okay. What people do is, okay, just go back a little. Patient, have the patient ankle outside the bed, at the edge of the bed. Take the patient's ankle at the edge of the bed. Now what we have to do is basically, take the foot to dorsiflexion, or if you can, hold the medial malleoli and the lateral malleoli. Okay, hold the medial malleoli and lateral malleoli and push the whole foot downwards. Push the whole foot downwards. Now when I push this whole foot downwards, what happens is I am actually pushing the metatarsals, I am pushing the cuneiform and all, I am pushing the calcaneum downward also. That whole set, when I am pushing, it takes the talus also down because I am fixing the tibia and fibula. You understand? Because I am fixing the tibia and fibula, when I move the foot, what happens is the whole set, like the talus, the calcaneum, the cuneiforms and the tarsals, all become one unit. All become one unit. and thereby mobilization is easy. You understand? So pushing downwards is what now? Posterior glide. Okay. Now I am doing a posterior glide. Now what is the range of motion increase? Why?
Convex opposite.
Which is convex now? Talus. T base convex. Guys, still you are confused with means you don't know bone anything. How is the bone? I'm telling you this. What is this? Then Then how can you get confused when I'm showing you all the figures? God, please. Whom should I go and where should I hit my head? Tell me one big stone. Medina, I can't go to hit that stone there. Okay, push downwards. Okay, push it downwards. So the movement, what is happening is posterior gliding for the talus. Now talus is a convex bone. Talus is a convex bone. So convex going in one direction. What will happen to the long axis?
Opposite direction.
Opposite. What is the opposite direction?
Plantar.
Opposite is dorsiflexion. Why do you think so much to answer one answer? So, my posterior glide in ankle increases my dorsiflexion. Clear this, guys? My posterior glide in the ankle creates dorsiflexion, increases dorsiflexion. Remember this. Okay? See, guys, if you know the concepts, everything is easy.